I'm passionate about improving service for patients, and as part of that I decided to take on the CUSA course in January 2020. Obviously COVID arrived during that course, and this gave me the opportunity to think differently about what we currently do. As a podiatry manager, we currently manage in podiatry wounds on a regular basis, and this was prioritised by the Department of Health. But one of the next challenges for us was obviously how we could assist the organisation in supporting the acute unit. So one of the things we picked up was that we work very closely with the community nurses and that we do some of their caseload as a shared resource. So in podiatry we took on the nursing caseload of wound care and took all of that on so that they were more free to follow up on more acute areas. So this required us to work flexibly, take on things like leg wounds, pressure sores and even head wounds, things we hadn't done before but were prepared to use our skills appropriately. We took on 108 extra visits per week within the department, and this gave us an opportunity to review the care plans for those patients. We found that quite a few have needed referral on to other services like OPAT or the multidisciplinary foot team, and some of them, in our opinion, needed a change of regime. This led to a significant patient improvement. Patients liked the experience that they were undertaking. Some of it was a challenge back to themselves to help look after themselves in more appropriate and signposted ways. We reduced the number of visits that the patients then required, and when we handed the caseload back to the nurses, podiatry had taken on 10 more visits and a 2% increase in our caseload, and we only handed 63 visits a week back, which released 42% of nursing capacity back into the community nurses. Moving forward, as part of this change, we're now looking at how podiatry continues to assist the community nursing teams and running audits on their wound care so that we can provide better treatment plans.